Good morning, everybody. Thank you for joining today. Welcome to this webinar co-organized by UNICEF and WHO in the run-up to the Nutrition for Growth Summit, which will be hosted in Tokyo from the 7th to the 8th of December later this year. My name is Joe Jewell, and together with Katrin Engelhardt, Fabio Gomez, and Holly Rippin from WHO, we have convened what we hope will be a really informative and inspiring session for you, focused on country examples on implementing fiscal measures for healthier diets. Before we begin, I would like to take care of a few housekeeping issues. First, regarding interpretation. Please note that interpretation is being provided in Spanish, French, Russian, and Arabic for this session. In your meeting webinar controls, please click Interpretation with the globe symbol at the bottom of your screen, then click the language that you would like to hear. Second, regarding recording, this session is being recorded and it will be shared on the Health Week website. Now, to begin the session, this webinar is the sixth in a series of webinars that our two organizations are organizing with the purpose of highlighting key priorities and action that countries are taking or are planning to take to deliver essential nutrition actions, improve food environments, and promote safe and healthy diets for all. In this session, we're focusing on the use of fiscal measures to promote healthier diets. Fiscal measures are recommended in international policy frameworks, independent expert reports such as a Commission on Ending Childhood Obesity, and feature in the package of WHO Best Buys as an effective intervention for tackling diet-related NCDs. Specifically, they recommended taxation on sugar-sweetened beverage and implementation of subsidies to increase the intake of fruit and vegetables. Both our organizations, WHO and UNICEF, support countries in their efforts to introduce fiscal measures. The objective of this session is therefore to help drive ambitious and impactful country commitments at Nutrition for Growth by showcasing the great work and initiatives led by countries in this space and learning from their experiences on how they developed and implemented policies, the results, outcomes of their actions, and some of the challenges they faced and how these were overcome. We're really lucky to have a great group of contributors from around the world with us today who will share their rich and diverse experience in this space in what I hope will be an engaging conversation. Without further delay, I would like to introduce and hand over the floor to Dr. Nina Prasad, Director of the Food Policy Program at Bloomberg Philanthropies, who has kindly agreed to moderate the session. Nina, the floor is yours.
Thank you, Joe. I'm delighted to be here today. As Joe mentioned, I lead the Food Policy Program at Bloomberg Philanthropies. Our program supports public health stakeholders in countries around the world to adopt and evaluate policies aimed at improving the food environment. This includes policies like reducing children's exposure to harmful marketing, front of package labeling, and the subject of today's session, fiscal measures. In the 10+ years we've been supporting this work, it has been amazing to see the accelerating momentum for sugary drink taxes in particular. And so today's discussion provides an important opportunity to hear from experts from around the world who have been at the forefront of policy development, implementation, and evaluation in this space. Before we begin, I'd like to mention that there will be a question and answer session after the moderated panel discussion. We encourage you to submit questions for the speakers in the Q&A tab as we go along. Please be sure to include your name, organization, and who your question is being addressed to. Also, please upvote any of your favorite questions you see posted. We will try to answer as many questions as possible within the allotted time. To begin our program, I'd like to introduce Professor Franco Sassi, Chair in International Health Policy and Economics, and Director of the Center for Health Economics and Policy Innovation at Imperial College in London. Franco will help set the stage for our discussion by sharing his perspectives on the state of the evidence surrounding fiscal policies for health. Franco, the floor is yours.
Thank you, Nina. I'm pleased to be able to present a summary of the evidence on taxes on food and non-alcoholic beverages. I will start by talking about the evidence on sugar-sweetened beverage taxes, because that is the area where taxes have been applied most widely. I will keep this distinction between sugar-sweetened beverages and other foods high in fat, salt, and sugar for taxes. because this is the way taxes have been designed so far, but I will explain at the end of my presentation that this distinction should really be overcome in the future. So the taxes on sugar-sweetened beverages have become very popular. They've been adopted very widely by a large number of countries, and there is very good evidence today that there have been a number of evaluations that have covered many of the taxes that have been implemented in smaller and larger jurisdictions. And there's very good evidence that taxes do reduce the consumption of sugar-sweetened beverages. There's also some initial evidence. I should say that these taxes are pretty unsophisticated in terms of tax design. I mean, they're pretty straightforward, and most of them are excise taxes. They're pretty straightforward excises that apply to a range of beverages. But some of them, at a small number, like the soft drinks industry levy in the United Kingdom, or the tax that has been applied in Portugal, or the tax that has been applied in South Africa, have a more sophisticated design and link the amount of the tax to the sugar content of the beverages. And there's some initial evidence that these taxes can actually incentivize beverage reformulation by manufacturers, in addition to reducing consumption of sugar-sweetened beverages. As you probably know, the WHO is engaged in a complex guideline development process that is leading to the production of guidelines on sugar-sweetened beverage taxes and the use of taxes more generally on beverages and foods. The process has not been completed, so I'm not going to talk about the evidence that has been produced there, but I'm showing here in this slide a systematic review and a meta-analysis that has been produced and published in 2019, which, as I say, is not the same as the evidence that WHO is gathering, but I would say that the bottom line goes in the same direction. So I think it's useful to look at this to have a summary of our current knowledge on the effectiveness of taxes on sugar-sweetened beverages. And if you look literally at the bottom line in this graph, you will see that the conclusion of this broad review of the evidence has been that the response of consumers to taxes is virtually one-to-one. So for a 10% tax that leads to a 10% increase in prices, if it does, there is a response by consumers that is effectively a reduction of 10% in the consumption of sugar-sweetened beverages. So this is a very encouraging result, and as I say, it is a pretty robust result that we can identify across a number of taxes that have been applied across the world. But there is a question that has not been really answered by the evidence so far, and that is whether these taxes make a difference in terms of people's overall diets. And here, the jury is still out. We do not have very good evidence of this, partly because it is incredibly difficult to measure changes in diet following the taxation of a relatively narrow range of beverages or foods or beverages, and partly because the studies that we have so far have not been robust enough or designed in a way that would really give us an answer to that question. So we're not able to say whether there is a true improvement in people's diets through these taxes. But the assumption is that if we reduce consumption of sugar-sweetened beverages, diets should improve, and that should lead to improved health outcomes as well. Let me switch to taxes on foods that are high in fat, salt, and sugar, or subsidies on healthy foods. I'm just running quickly through these slides because I have limited time, but I hope it gives you at least a broad idea of what the evidence is telling us at the moment. So these taxes are less talked about and less often evaluated, but there is a relatively large number of countries that have adopted taxes on foods high in fat, sugar, and salt. These are mainly small jurisdictions. Of the large countries that have adopted these taxes, I must say that three, all in Northern Europe, Norway, Finland, and Denmark, have repealed those taxes. Some of them have kept them for a very long time. but they've recently repealed them for different reasons. And there are two large countries that are still using these taxes, and these are Mexico and Hungary, where these taxes have been reasonably successful. The evidence base on the impacts of these taxes is limited. It's narrow. There are few taxes that have been evaluated, and the evaluations are not particularly strong. The evidence is better for subsidies, but again, I mean, it's only in one particular area, that is fruit and vegetable subsidies, not on all types of subsidies. Here, the question is that the impact on consumption of foods that are taxed or subsidized is plausible. From price elasticity studies, from modeling studies, from the limited evidence that we have, we can gauge that an effect on consumption of the foods whose prices are changed by the tax or the subsidy is plausible, but again, the impacts on the overall diet remain uncertain, because it is even more likely than with beverages that people will engage in substitutions in the case of taxes and subsidies on food, and we don't really know what these substitutions are and what effect that they will have on the overall diet in terms of calorie intake and nutrient profile of people's overall diet. So a number of conclusions can be drawn from this evidence, and I will try to summarize those in this final slide. There's no question that the taxes that have been introduced so far have been revolutionary, because they, for the first time, these taxes introduced the principle that health can be a key driver in the design of a fiscal policy. It wasn't like that for tobacco and alcohol, because tobacco and alcohol have very strong justifications in a more traditional economic sense. They're mainly in terms of externalities and in terms of the characteristics of the commodities that are being taxed. But for the first time with sugar, sweet and beverage taxes, we're really introducing a new principle in fiscal policy, which is that health can be a key part of the rationale for introducing taxes. So the countries that have managed to introduce these taxes facing up to major pressures from lobbies and vested interests have to be praised for their, as I say, revolutionary role in this area. However, we need to take stock of the evidence that has been produced so far and understand, what the successes have been, as well as the limitations of the current models of taxation that have been used. There's no question that the taxes that have been introduced are small, and they're unlikely to have a big impact on people's diets. Even if they do have an impact on people's diets, which is something that we don't know, as I have explained earlier, they're unlikely to make a big impact. The risk of substitutions, particularly when foods are taxed or subsidized, remains high, and we don't really know what people are going to substitute into and what the overall effect on their diet is going to be. So what these evidence points to is that we really need a more holistic system of fiscal incentives. So we cannot just focus on a small range of products and allow people to make substitutions. So we need to have a holistic system of fiscal incentives that really provides incentives for people to switch from foods and beverages that have a poor nutrient profile to foods and beverages that have a better nutrient profile. And for doing this, you really need to have fiscal incentives that apply to the entire food supply. In all countries in the world, foods are taxed. I mean, they're already taxed. And I'll show you a graph that is based on calculations that have been made in the United Kingdom that shows you the difference between the soft drinks industry levy, or what a household pays in terms of the soft drinks industry levy, which is the tax on sugar sweetened beverages in the UK, and what households pay on VAT, which is the general consumption tax that is applied to food. There is a huge disproportion between the two taxes, and the amount of money that people pay in taxes on food already today is huge compared to what they pay in soft drinks industry levy. So the question is really to start from these very large pool of taxes that people are already paying on food and beverages and repurpose them to bring them in line with the nutritional quality of the foods and beverages that people consume. This would be, an extra step in the revolution that I was talking about earlier. And this is really what will make a big difference in terms of the health outcomes of people's diets in the future. Thank you.
Many thanks, Franco, for that very succinct and useful presentation. It's not easy to summarize that amount of evidence in 9 or 10 minutes, and you did a brilliant job. That was a great primer, and you've set the stage nicely for our subsequent discussion. I particularly appreciated the note you ended on. There is great stuff happening, to use your words. There has been a revolution, but there is lots more to do. And these are ideas we will revisit later on. Now I'd like to move into the main part of our session, during which we'll hear from an esteemed group of experts from around the world about their country's experience with using fiscal measures to improve diets. We've opted for an interactive panel discussion format today instead of a series of presentations. So without further delay, I'd like to invite our panelists to turn on their cameras and join me on the virtual stage. Great. Great. I think we have everyone. Thank you all for being here. I'm going to start off with a quick round of introductions of each of our panelists, and then we will jump into the discussion. There is a lot of good stuff to talk about, and I'm very excited about this global tour of fiscal policies that we will be taking together. So joining from Kuwait, we have Dr. Nawal Al-Hamad, who is Assistant Undersecretary, Deputy Director General of the Public Authority for Food and Nutrition. From Mexico, we have Dr. Arantxa Colchero, Associate Professor at Mexico's National Institute of Public Health. From Portugal, we have Dr. Maria João Gregorio, Director of the National Program for the Promotion of Healthy Eating, Directorate General of Health. And from South Africa, we have Mr. Mpho Lagote, Director of VAT, Excise Duties and Subnational Taxes from the National Treasury of South Africa. And last but not least, from Saudi Arabia's Food and Drug Authority, we have Dr. Faisal Fahad bin Sumaid, who is Director of the Healthy Food Department. A big welcome to you all, and thank you for making the time. There are a lot of people at this session, so it's clearly a very hot topic at the moment, as it should be. I would first like to ask each of you, in about a minute, if you can, to tell us about the country, or tell us about the policy your country has in place, specifically what it covers and how it's structured. This will help ensure everyone's on the same page for our following discussion, but I hope also demonstrate that countries are approaching this very differently. And while there is emerging evidence that sugary beverage taxes are working, we're still relatively early on. And so there's lots of opportunity to try different things. And what will come out in our discussion as well is that you can structure the tax to some extent to do what you want it to do. Is it to just reduce consumption? Is it to spur reformulation? So it would be really great to hear from each of you about how your country has approached it. Arantxa, I'm gonna start with you because I think of everyone here, Mexico's tax has been in place the longest and really, I would say put sugary beverage taxes on the map. So Why don't you kick us off?
Okay, thank you, Nina. Thank you. Thanks for inviting me. So yes, in Mexico in 2014, an excise tax was implemented of 1 peso per liter. That's about a 10%, 11% increase in price. And it applies to all non-alcoholic beverages with added sugar. It excludes 100% juices. We have very few in the country. And the beverages with artificial sweeteners. The tax, of course, is higher because it's a volumetric tax for beverages of larger packet size, which are relatively less expensive in Mexico. The tax is paid by the producer, and just since 2019, we have annual adjustments to inflation. Just very quickly, we also have a tax, an 8% tax to all non-essential energy dense food in Mexico. That was implemented along with the SSB tax.
Thank you. Thanks, Arantxa. Next, I'm going to go to Portugal, to Maria João.
Thank you so much, Nina, and thank you so much, UNICEF and WHO, for inviting me for this webinar and for this opportunity to share the Portuguese experience. So we in Portugal, since 2017, we have a tax on sweetened beverage, and it covers both sugar and non-sugar sweetened beverage, but it excludes, as Mexico, the fruit juices, and it is a theory design tax. And during the first year of the implementation of this tax, this measure was divided into 2 tiers: a lower tier for those drinks with sugar contents below 8 grams per 100 milliliters, and a upper tier for those beverages above 8 grams of sugar. And 1 year after the implementation of this tax was redesigned for a more complex tier redesign, and 2 additional taxation tiers were created with the aim to promote further product reformulation. So nowadays, this tax has 4 different tiers. The first one is for beverage with a sugar content below 2.5 grams. The second is for beverage with a sugar content between 2.5 and 5. The third for beverage with a sugar content between 5 and 8 grams, and the higher tier for beverage above 8 grams of sugar. Thank you.
Excellent. So very different approach from Mexico, as I'm sure our audience is noting. I'm now going to go to Saudi Arabia. I'm moving in the order that these taxes were implemented, and Saudi Arabia came after Portugal. So Dr. Faisal, over to you.
Thank you so much for actually being introducing ourselves over here, and thanks a lot for the invitation from the WHO side as well and the UNICEF. Basically, as you stated before a while, that Saudi Arabia becomes the 3rd place for implementing the taxation, like the sin taxation, or what we call it excise taxation, being implemented in June 2017. The first taxation design was implemented on carbonated drink and energy drinks. The design that we used in Saudi Arabia was actually flat rate tax, which is basically 50% for the carbonated drink and 100% for energy drink. Next came in 2019, December, we've implemented the sugary sweetened beverages taxes on all sugar drinks, basically 50% as well. So basically, I know it's a different approach, or maybe a different design that's been implemented worldwide. But here in Saudi Arabia, we'll be doing over here the flat taxation rate. Thank you so much.
Great. So a very high rate of taxation in Saudi Arabia, which will be interesting to hear how you accomplish that. I'm going to move us along next to South Africa. And Po, keen to hear about South Africa's tax.
Thank you, Nima, and thanks to UNICEF and the WHO for inviting me to talk about South Africa's experience. We implemented the health promotion levy in April of 2018. Basically, the health promotion levy is a tax on sugary beverages. We implemented it at a rate of 2.1 cents per gram for sugar above 4 grams per 100 mils of sugar content, and that equates to about 11% of the price for the most popular beverage in South Africa. In that tax design, we exempted 100% fruit juice and also unsweetened milk and milk products. They are temporarily excluded in terms of the first phase of implementation, but the tax covers powder and liquid concentrates of this product, and the way that is then calculated in terms of tax liability, we looked at the total volume of the prepared beverage. The tax was increased the following year in April of 2019 to 2.21 cents per gram of sugar. So initially we wanted to tax every gram of sugar, but through consultation we settled with a different design, which included a threshold and a reduced rate, which then equates to about 11%. We wanted a 20% tax rate on these beverages when we started. Thank you very much.
Thank you, Mpo. And I'd like to come back to how you went from 20 to 11, because I think that's going to be really informative for our audience. I also, Mpo, would like to ask you one follow-up question, which is, you mentioned that the tax in South Africa is called the Health Promotion Levy, which, it was subtle, but I think it's so powerful to frame it that way versus a tax, because we all know what happens when you say you're going to place more taxes on people. But you made the decision to call it a health promotion levy, which I just think is brilliant. Can you say anything about that?
Yeah, I mean, as this was indicated by Franco before, around the idea of using fiscal instruments to assist in terms of dealing with health issues, we thought that a health promotion levy will communicate that message, to say that the tax that we are introducing, the intention is driven from a health perspective, in terms of addressing some of the, or in this case, to begin with, the sugar on sugary beverages. So that's why we started with naming it a health promotion levy. But I might just indicate that basically that is the umbrella name that is going to be used. So basically we can have additional levies under that health promotion levy, which will be maybe a tax on, maybe for example, on saturated fats, or a tax on other things, but it will be under the umbrella of health promotion levy.
Excellent. So it sounds like you're just getting started in South Africa. And then finally, I'd like to come to Dr. Nawal from Kuwait. I believe Kuwait's tax was implemented our summer, North American summer, last June 2020. But eager to hear more from you, Dr. Nawal.
Thank you so much. I'm happy to be joining, and it gives me the pleasure to be participating. So Kuwait has signed the Unified Agreement on Excise Tax Treaty for the GCC, the Gulf Cooperation Council, in November 2016. And it states that it imposes the tax on goods deemed harmful to human health and the environment, as well as luxury goods, according to a list of goods and corresponding tax determined by the Ministerial Committee. Now, although I'm saying November 2016, in Kuwait it was by December 2019, as my colleague Dr. Faisal just mentioned, that it has taken into effect. And the target was to impose 50% on soft drinks, sugar-sweetened beverages, and 100% on energy drinks. And we are at the moment trying to do the following, which is in two phases. The first stage is to a unified value that imposes tax of 50% on the retail price. And then the second stage, which comes later, the gradual to impose the tax determined by the actual sugar content in ascending order. We are approaching this stage now.
Excellent. Thank you so much. Thank you all for those overviews. And, again, just emphasizing the very different approaches that countries are taking. And we are learning a lot through these experiences. I now would like to take a step back and understand the policy journey a little bit more. Perhaps I will start with you, Dr. Faisal. Can you say a little bit more about how Saudi Arabia managed to get fiscal measures on the policy agenda? And more specifically, was there a tipping point for action, and what was that tipping point?
Yeah, for sure. Thank you so much, actually. First of all, let's talk about let's say everyone is basically from well-known organization, for example, WHO has recommended from the beginning that actually some sort of taxation on high sugar, salt, and fat foods may actually have a positive effect on the human health. So basically that's the idea, or that's the tipping point started in Saudi Arabia and in other GCC countries, as well as Dr. Nawal Hamad mentioned before a while. Obesity and diet-related diseases here in Saudi Arabia specifically are a major public health challenge. How we can deal with it? We need to impose some sort of, let's say, tools in order to tackle this problem. In addition, in 2013, there is actually a survey published by the Saudi Ministry of Health. And the survey unfortunately showed that the prevalence of obesity among the Saudi community accounted to almost 59.4%. in the Saudi community, which is actually, I guess that's a huge number. In addition, the Kingdom of Saudi Arabia actually is a leading country worldwide when it comes for the prevalence of non-communicable diseases. For example, according to the WHO report published in 2016, non-communicable diseases are estimated to be accounted for almost 73% of all deaths in the country, which is, I guess, again, it's a good, actually, I'm not saying a good number, it's a high number, unfortunately. In addition, evidence, and I guess Professor Franco has actually spoken about it from the beginning, and he was saying there is actually a positive effect if we're gonna implement some sort of taxation on the high salt, sugar, and fat foods. And based actually, I'm probably gonna ask why you targeted, for example, carbonated drink at the beginning. Unfortunately, carbonated drink here, based on the studies published by Dr. Swaikit in 2019, Saudi Arabia residents were the 4th largest consumers of calories from carbonated drinks globally. So basically, if you're gonna go through the whole evidence or the whole thing that I've mentioned before a while, I guess that's actually need us as a country to impose some sort of measurements or measures in order to tackle the prevalence of non-communicable disease and obesity. And that's why the idea of, I'm not going to say the idea, that's why the taxation, or what it's called, what we're going to say it's cent taxation being imposed in Saudi Arabia and other GCC countries.
Great. I work in tobacco control as well, and we know we've got decades of experience from the tobacco space on the impact of tobacco taxes, and of all the demand reduction policies we have, taxes are the most effective for reducing consumption of tobacco. And so it follows that the same would be true for sugary drinks and other harmful products, though they're not at all, the same. You have different price elasticities of demand, and but it is interesting to see how much of the tobacco control playbook can be translated to this space, and that's a topic we'd like to come back to later.
Actually, we do have a taxation over here in Saudi on tobacco, which is 100% as well.
Excellent, love it. Great. So would anyone else like to comment on your country's policy journey, and if there was a tipping point for action?
Thanks, Nima. I think, from our side, the policy has been driven by the Department of Health because they had a strategic plan for the prevention and control of non-communicable diseases. And in the strategy was for 2013 to 2017. And the strategy basically highlighted all the risk factors that are contributing towards the high rate of non-communicable diseases in South Africa. Because at the time, basically, when they looked at the death rates and the causes of death, looking at that non-communicable diseases were the leading cause of death in South Africa compared to communicable diseases. And that's why then they developed the strategy to look at dealing with an issue of non-communicable diseases. And in that strategy, it identified that the high sugar intake amongst the other things like salt and fat were quite problematic and contributing to non-communicable diseases. And the strategy identified the role for fiscal measures in terms of addressing that issue. And then a follow-up strategy to that was the national strategy on the prevention and control of obesity, which also highlighted all the risk factors towards obesity and how then, from a government point of view, we can start dealing with those issues. And that strategy also included an element of fiscal measures to be used to address, especially the dietary issues that are contributing to obesity. So we started then engaging with the Department of Health around 2015. We started with the discussion around that because the Department of Health cannot implement fiscal, especially tax measures. So we started engaging with the department. And during that time, also academics were starting to write a lot about the issues of non-communicable diseases and obesity in South Africa. And actually, it was found that South Africa, when you look at sub-Saharan Africa, was the most obese country compared to other member countries in the sub-Saharan Africa. So we needed to then start looking at implementing fiscal measures. So the first step in that direction was to deal with sugary beverages, as was highlighted in those two strategic documents from the Department of Health. And basically then that started the process, because again, government is looking at implementing the national insurance coverage, health insurance coverage. And then again, looking into the future, that if we don't start dealing with non-communicable diseases, that is going to be a problem for the health sector going forward. So we needed to start somewhere, and sugary beverages was the starting point. Thank you.
Great, thank you, Paul. Dr. Nawal, if you could please come in, and it would be, you've mentioned the cooperation among the GCC countries, and I wondered if you could comment to that as well. There are, a number of these communities, regional communities around the world, and are there lessons from the experience of the GCC that could perhaps be useful to other places?
Yes. Funny enough, when we started together, there have been different rates on, like Saudi started much earlier, and then UAE again, and we are just starting, but we do share common problems with overweight and obesity, with lifestyle being very sedentary, and everybody's taken their own time, long time, but in implementing policies and strategies, of course, based on research and WHO recommendations. And from our part, we've been concentrating on school children, because when we looked at school canteens and the school nutrition friendly schools, we've then realized how much of the sugary drinks children have been consuming. And it was shocking data because they're not using water anymore, they're not drinking milk anymore, or it's different products, it's sugary drinks. And this is where we tried to implement the strategy of taxation. When we saw that it was taking a long time, what we did was we partnered with the private sector. There are only 6 local fruit juice producing and nectar companies. And it was amazing how when we educated them and nutritionally became more aware of the benefits where it is a win-win situation, we convinced them to reduce the amount of sugar added to these juices. It was amazing how we succeeded much more, long before we started the taxation or starting the taxation. So I'm just saying that it's a huge challenge. It's not easy to do. Taxation still not implemented in Kuwait, but I'm just talking about our experience with working with the private sector and how resilience there was and how helpful and cooperative they were.
Thank you for that. That's actually a nice segue to the next question I would like to ask. And Arantxa, I see your hand up, but I was really hoping you could take this next question. And that is just around what some of the challenges in getting these policies adopted are. You know, there is, and Mexico experienced a lot of industry opposition. And I think it's important for countries to be prepared for that. What we are seeing, though, is industry tends to use similar arguments in every single country. You know, it's about jobs. These taxes are regressive. They're not going to solve obesity. So we are developing more evidence to be able to answer those questions as well. But before we maybe get into the evidence, Arantxa, I would love for you to talk a little bit more around who did you face opposition from in Mexico? What were their arguments and how was that managed?
Thank you, Nina. Well, we have a very powerful SSB industry in the country, and we were #1 consumers. Mexico was #1 consumer, and they claimed at that time that the consumption of SSB was not responsible for the obesity epidemic. And so the industry, so it was part of the opposition that we faced. But also, different from South Africa, the Ministry of Health was not supportive of the tax. And I think we didn't know that a tax was going to be implemented, but in Mexico, there was a strategic partnership. We had advocacy organizations raising awareness among the public, lobbying organizations, convincing with very novel ways to do it, convincing members of the Congress. We in academia, we generated evidence about increasing trends in obesity, that added sugar represented 12% of the diets. And I guess what it was interesting is that Mexico needed revenues, and so the Ministry of Finance was supportive. And the proposal came from the government, actually. It was lower than we expected. It was just 1 peso, so 10%. And so it was strong because it came from them, from the government. We didn't expect that. So it was a new government, a new Congress. There was a lot of evidence. There were price elasticities, revenues expected. So I think the combination of all these made to what we have now, the SSB tax. Just very quickly, Nina, I think the government framed the tax as to tackle the obesity epidemic, but maybe this is not a good idea because then the industry is saying, see, there's no evidence that you moved obesity, and it's very difficult to move obesity. You would need a very comprehensive package of interventions to do it. So we have to be careful because at the end, you can show really that we moved obesity. Thank you.
Thank you, Arantxa. It's such an important point in how we talk about this tax and what we're expecting it to do. I mean, I don't think anybody here expects that a tax alone is going to reduce obesity. It's got to be part of a package, but it's a really great reminder around the narrative we use on the objective of these taxes. I would like to continue on this topic of opposition and how it was overcome. Dr. Faisal, you have your hand up, and Maria Zhao, I'd love for you to come in afterwards if you'd like.
Thank you so much. Sorry, Dr. Maria, just to mention something, when Dr. Nawal mentioned about the food industry behavior when it comes for the reduction of sugar, like basically over here in Saudi Arabia, you're gonna be surprised. There is a competition over here in the Saudi market when it comes for the juices or the sugar drinks in order to decrease or reduce the amount of sugar in their food and their product. Like, for example, now in SFDA, I will talk from the experience of SFDA. We do receive a lot of requests in order to correct the health claim, no added sugar. Because in this case, all the juices or all the beverages, I'm gonna say the beverages, all the sugary drinks, and this once they put the claim, in this case, there is no tax will be implemented on them. So we received a lot over here in Saudi Arabia as SFDA, a lot of requests in order to make sure that they are actually complying with the claim, which is actually a good thing I can see. And if you go to Saudi market right now, most of the sugar drinks in the Saudi market, now you'll see a label of it, no added sugar, which is actually it's a good thing. I know, going back to Dr. Raja, when she was saying like obesity, it won't be tackled like within a days or within a year or within 2 years. Totally agree with you. And this is the way how there is a way to convince the food industry in order to say, like, for example, obesity, it won't be resolved within like a second. Obesity, it's need like a long run for each and single country around the world, needs a long run in order to reduce it or tackle it. That's basically some sort of short comment. Sorry, Dr. Maria, I'm really sorry about it. Sorry for the interruption. Thank you so much.
Thank you. Thank you so much. I can share the Portuguese experience. So to deal with this opposition from the food industry, I think that we have defined some kind of a communication strategy to engage the general population and to get the public support for this measure. And our main approach is similar with South of Africa. Since we communicate is that a public health tax, and that this tax will be able to influence food consumption and maybe influence the health status, in particular for the most vulnerable groups, like children and also teenagers. And in this communication strategy, since the beginning, we informed that the tax revenue will be allocated to the Portuguese National Health Service. And that information was really important to engage the public with this type of measures. And actually, I think that we have good results with this approach, because in 2019, a survey was conducted in Portugal to understand the public opinion in terms of this type of measures to promote healthy eating. And in particular with this measure, about the 85% of the population agree with this tax. I think it is a very important result. And additionally, 48% of the population consider that this tax should be expanded and cover other foods. So these results and the public support was really important to deal with the opposition from the food industry.
Many thanks, Maria. That's really fascinating. 85% support. And that aligns with the experience we've had in our program, which is if you take the time to educate people on why this product is harmful, and what the solutions are and what the responsibility of the government is to protect public health, people tend to come along. And we often support a lot of public opinion polling in the countries where we work, and we have found high levels of support. And I think when you show those numbers to governments to say, look, 85% of the public is behind you, it then gives them the sort of the courage to move forward with this policy. So I think it's really, encouraging to see that this is something the public understands and supports. I see a couple of hands up, but if it's okay with you, Mpo and Dr. Nawal, I'd like to move on because we have a lot of really good stuff to cover in our time remaining. And in particular, I'd like to spend a few minutes on the question of impact. I'm seeing some comments in the chat suggesting that, Mexico's tax didn't reduce consumption. And Arantxa, I would invite you to respond to that because, Mexico has, in my understanding, the most comprehensive evaluations have been done of the impact on consumption or purchases of sugary drinks. And in addition, you've also looked at the impact on the economy and jobs. You've in some ways addressed this question of regressivity. And I would love, Arantxa, for you to provide us with a few high-level takeaways of what is the data showing us in Mexico and what is the story that's emerging. And Mpo, I'd like to move to you next on that question, if you could.
Thank you, Nina. Yes, so there are a lot of studies in Mexico showing that there was a reduction in purchases of SSBs. So the first year it was a 6% reduction, and the second year it was even higher, 10%. So on average, it was about 7.5% the first 2 years. There are other studies that showing even larger effects, but it's interesting because this is an average reduction in purchases of SSBs, but lower income households had largest reductions, about 10%, and high consumers also. So this is an interesting result. And the fact that lower income households had higher reductions of SSB is good because then the tax is not regressive, and we looked at household expenditures and it didn't change. We also found that there was an increase in basically water, which is a good substitute, although it's not potable water. We haven't even been able to show that, but at least we know that people are consuming more water. We also showed that there was not an impact on employment, because this is what the industry claimed. For the two taxes we had, there was no impact on the beverage industry, on the unemployment in general, and on the stores, because there was the concern that the stores would lose with the taxes, and they didn't. So I think these are, because then the other countries can use this information. Why would that be different? Why would the no impact on employment would be different in other countries? And one thing is that the beverage industry is the one that produces the substitutes, so they don't lose. They also sell water and other untaxed beverages. Thank you, Nina.
There's really great evidence that's come out of Mexico and many other places, and I urge participants to take a look at some of that evidence. And Mpo, would you like to comment on what you're seeing in response to South Africa's tax?
I mean, in the case of South Africa, since the implementation of the health promotion levy, basically there have been two studies that we have seen that were done by University of Witwatersrand. The first study looked at the changes in the prices of products on the market, and basically the study then showed that the prices of the tax products increased compared to those that were exempt. And another study looked at the consumption of the changes in consumption of the tax beverages, and they observed that actually lower income households in that particular study that they were looking at, they reduced consumption of the tax products, basically reducing the sugar content or the sugar that you're consuming from that, because the relative prices had changed in the market. And another issue that basically the industry then did was that once the tax was implemented, then they started to promote more the products that were not taxed, like your sugar-free products, by increasing like the size of the containers for those, and the price also was relatively cheaper than the tax products. So from there, basically, then you started seeing a lot of consumption of the non-taxed items. But from a government point of view, we haven't really done an assessment of the impact, but we are seeing that in terms of the revenues since implementation, that they have been increasing year on year, that they've been decreasing year on year, basically showing that there is a reformulation that is happening in the market. And I think the issue is just to look at an assessment where basically then that can be decoupled from reformulation to consumption, to look at what the balance is. But we are seeing that in the revenue that is decreasing on an annual basis, that there is either reduced consumption combined with the reformulation of the products that are there in the market.
Excellent, thank you, Mpo. And Maria Zhao, I wonder if you could comment. So we've touched on some of the evidence emerging from a volume-based tax. We've touched on a sugar-based tax in South Africa, and Portugal has a tier-based tax. Could you say a little bit about what you're seeing in Portugal?
Yes, thank you for this question. Actually, we have some data on this, and in terms of the results of this fiscal measure, we had good results, both in terms of its impact in reducing the soft drinks consumption, and in terms of beverage reformulation. So according to our official data, we know that after the implementation of this tax, and in particular between 2017 and 2020, soft drink sales had a 17% of reduction. Maybe we think that is related with price elasticity, and also with the reputational effects of this measure in this type of products. But actually, the most important effect of the tax was the reduction of the sugar content of the beverage covered by this tax, and it was observed a strong increasing trend for the proportion of the beverage that belongs to the lower tiers of taxation during these first 4 years of implementation of this tax. And data from the first year, we estimated that less 5,000 of tons of sugar were less consumed regarding the consumption of this beverage. And during the first impact evaluation of this tax, we had also the WHO support in order to be possible to undertake an impact analysis on health outcomes, and considering data from this first year of the implementation of the tax, the sales reduction and the reformulation process should result in 1,600 fewer obese people, and according to WHO, should avoid or delay at least 27 deaths directly related with the excessive sugar consumption in Portugal, and this is data for every year. So this is some of the main results that we have regarding this fiscal measure.
Excellent. Thank you, Maria. Also a very optimistic picture emerging from Portugal. I'd now like to steer our conversation towards advice and guidance to countries that might be listening in for inspiration. As you've all been deeply engaged in the policy process, what in your view was the most important step that you took that you would definitely recommend other countries looking to introduce a tax should also do? Dr. Nawal, can I start with you?
Yes, thank you, Nina. I mean, I just want to say first, it's amazing results from Portugal and Mexico. It's really, really amazing. And for me, it's something that I'll take to politicians. So what I would recommend for countries is to make use of the data that is available and how it has impacted the population. And it has, I mean, here Maria is talking about 5,000 tons of sugar not consumed. That is amazing. I mean, this is what we're looking for people to change some behavior in consumption of sugary drinks. It's not the whole thing, but it's somewhere to start. And I think, yeah, this is what has really, just now, it's amazing, the results. I think this I would advise to countries, experiences from other countries. It's amazing.
Well said, Dr. Nawal. Thank you for that. Would anyone else like to come in on that question? Do you have any advice for countries about a critical thing? Dr. Faisal, please come in.
Thank you so much, Nina. And thanks a lot for our panelists actually for showing the results actually. Just to comment, just to say something actually about the impact over here in Saudi Arabia. Like, could you imagine that the sugar or the sales volume declined here in Saudi Arabia since we implemented taxation by 35%? Which is actually, I guess it's a kind of like a huge number compared to the other countries, since we have the highest rate of taxation. That's why we have the highest amount actually of sales volume decline. But I have to say something, and which is a thing that you have to put in your mind as a decision maker or as a policy maker. The policy should be actually driven by public in order to have the strongest action and the strongest compliance. Like, both of us as a food industry and a government entity, we do work for the sake of our consumers. We do work for the health of our consumers. We do work for the health of our public. But the food industry has different opinion when it comes to health, and the government has different opinion when it comes to health. But at the end, if the policy actually combined in a way to be driven by the public demand, in this case, I guess the challenge will be end over when it comes for the food industry. But the first thing and the last thing that we have to focus on, the policy should be driven by public in order to implement a strong policy. When I'm talking about policies, of course, I'm talking about nutrition policies. Nutrition policy doesn't matter if it's fiscal or other sort of regulations. At the end, nutrition policies is actually a challenge for the food industry. I'm not going to say it's a nightmare, but it's a kind of nightmare to the food industry. But we have to work together. We have to cooperate with the food industry in order to tackle it together. And at the end, public demand, policy driven by public demand is the best, I guess, in my opinion. Thank you so much.
Thank you, Dr. Faisal. And we completely agree. In the countries where we work, local public health experts and advocates spend a lot of time developing communications campaigns. And it's amazing to see, they'll often conduct a survey before they start a communication campaign to get a sense of what does the public think about this. And then they'll have a communication campaign on air for a few months. And the shift in public opinion as a result of that communication campaign, and just the growth growth in awareness and understanding is pretty amazing. So, I think that's an excellent take home for people, is to make sure you're bringing the public along with you and showing them why you're talking about a tax or whatever policy it is. And Po, I see your hand up, and I'm going to ask you my next question, which is, knowing what you know now, if you could go back in time and redesign South Africa's tax or do something differently, what would you do?
I mean, looking at the support that we got from civil society, from the health profession, in terms of getting the health promotion through the process, I think we could have gone a little bit further and included fruit juices and all of that, because even during those discussions, I mean, they were kind of like pushing to have it there, but then again there was an issue around balancing the fears around jobs and all of that. But I think we could have kind of like pushed a little bit further on that, so that at least the scope of the tax is much broader than it is now. And I think that that's the only thing. But from the support that we got from civil society, from the academics, it was amazing. I mean, from a policy policymaker, and my experience, actually, it was the first time that I saw so much involvement of civil society in terms of the tax and legislative process for implementation of a tax, and it was quite amazing to see the support that we have received. But I think maybe we could have pushed a little bit further in terms of coverage.
Thank you, Mpo. Really, really useful insights. Would anyone else like to come in on that before we shift to the question and answer?
Yeah, very, very quickly. I think one of the challenges in Mexico, and something we are still fighting for, is that taxes revenues are not earmarked, and actually the support from the public, we had in 2013 70% support for taxes from the public if revenues could be spent in investing in potable water or water fountains in schools. And so this is something that we know it would raise a lot of support, and it's been difficult. We are trying now. Well, the current government doesn't want taxes, but is more willing to accept earmarking. Another thing is that our tax is relatively small. So and it was introduced by the government, but we think we should double the tax. I think the design for Mexico is good. A volumetric tax is okay because there's a huge gap in prices, so people can substitute for cheaper beverages. Although we could combine, I think it would be a good idea to combine an excise tax with a tier tax, both, because the volume tax, the message is it is not good to drink SSBs. So adding a tier tax will be very interesting. And the other thing is we should explore how to promote healthy food. I think subsidies and looking at the whole food system is something that we should do along taxes to unhealthy food and beverages.
All really great points, Arantxa. Thank you for that. And perhaps a way to promote healthy foods and subsidize healthy foods is by earmarking revenue from the tax. But we know that, often ministries of finance and treasuries don't like to earmark. And Po, I won't put you on the spot as our sole treasury participant here, but that has certainly been our experience. So perhaps that is the next sort of frontier, is really pushing on earmarking. I'd like to shift over. We've got lots of great questions coming in from the audience, and I'd like to make sure we leave a few minutes to address those. But before we do that, I'd like to invite Professor Franco to come in and just offer any reflections on the discussion. And Franco, there was a question in the chat around, what is the ideal tax rate? I wondered if you could also comment on that as you're providing some of your reflections.
Thank you, Nina. That's a very good opportunity. I would like to go back answer your question by going back to the remark that you made at the start of the panel discussion, which is these taxes have different designs and they achieve what they are designed for, basically. So the design of the tax really has a major influence on the effectiveness of the tax. And designing a tax is not straightforward. This is something that really needs to be done with specialists and needs very, very close collaboration between health and finance ministries. As Paul rightly emphasized earlier, health ministries do not implement fiscal policies. And I find myself increasingly in discussions that are happening within the public health community as if taxes were entirely a public health policy, but no, taxes are a fiscal policy and they really need to be designed by specialists. Health ministries need to set the objectives of the tax and work with finance ministries to design a tax that can pursue those objectives. That is really critical. Of course, tax design involves many things. It involves determining what products are going to be taxed, involves determining the structure of the tax and the tax rate, as you mentioned, Nina. I think this is a good opportunity to dispel a myth. There was in the chat a statement that WHO recommends a 20% tax, which is not true. I mean, WHO doesn't have a recommendation on a particular level of taxation. What is important is that these taxes need to be large enough to make an impact, a meaningful impact on consumption of whatever product is taxed. So the 20%, comes from some modeling studies that have been done in the past. It's a very broad indication of by how much products should be taxed. Very crudely identified, but it's by no means a guideline. The larger taxes, the tax that has been applied in Saudi Arabia, for instance, that Faisal talked about, is a great tax. If a country has the political ability to implement a tax of that size, that would make a great impact on people's consumption. But a small tax will also be useful because countries have to start somewhere, and having a small tax is better than no tax. So I think these are all issues that really need to be negotiated between the health and the finance ministry. But as I say, just to conclude, tax design is really important, and a lot of care needs to be put into tax design if the health objectives that a country has have to be pursued.
Great, many thanks for that, Franco. I'd like to continue on with audience questions. Our next one is around definitions. So there are questions around what is an SSB? How did you define what that covered? And Arantxa, Mexico also has an unhealthy food tax. Perhaps you could comment on, how that is defined. Would anyone like to come in on that? Arantxa, do you want to start?
Yeah, so for SSB, as I mentioned, it includes all beverages with added sugar. It excludes 100% juices. We have very few, but there are more in the market, and I think they should be taxed, and it excludes beverages with artificial sweeteners. The food tax includes all foods that are that have 275 calories per 100 grams. So that's the threshold, and it includes all sweets and sweet bread and jars and all this, and it excludes. The Ministry of Finance included a list of foods that shouldn't be taxed because they are basic food. So this is what we have in Mexico.
Great. Would anyone else like to come in? And Poe, I'm going to ask you to comment for a moment, because I recall in the early days of South Africa's sugary beverage tax proposal discussion, there was quite a bit of back and forth as to whether juice should be covered. And ultimately it was not covered, but I would be keen to hear a little bit more around how South Africa has defined it and what some of the issues raised were in reaching that definition.
In South Africa, basically the text covered all the non-alcoholic beverages, except where the beverage is 100% fruit juice or 100% or it is not sweetened milk product. So not all the non-alcoholic beverages are included, and in there basically what has happened, if it's 99% fruit juice, it will be included in the tax because it's not 100%. And one of the issues that we were confronted with in the discussion was that if one makes a combination takes 100% fruit concentrate and add a little bit of sugar, there were discussions to say that the added sugar should be the only portion that is taxed, and we said no. We're going to tax. We're not going to be looking at making a distinction between the sugar coming from fruit juice, from fruit that is put into a juice, and the added sugar. Once it's not 100% fruit juice, it will be part of the of the tax, and we'll tax every gram, applying the thresholds that I indicated much earlier. But it's all non-alcoholic beverages that basically are more than 4 grams per 100 mils in terms of sugar.
Thank you. And Po, would anyone else like to address that? I wonder if either Dr. Faisal or Dr. Nawal. Please go ahead, Dr. Faisal.
Thank you so much. Sorry for that. Just actually to comment on Dr. Po, actually, which is interesting that you have actually implementing the taxation in everything, which is the same approach that we have over here in Saudi. Like, for example, any fruit or any fruit juices or drinks or whatever that has any small grams, tiny grams of sugar, the taxation will be implemented, which is basically over here. Like, in addition, I have to say something, like there is some sort of behavior that the food industry is taking, and we are trying actually in order to oversee and control as much as we can. They are substituting the added sugar with the fruit concentrate. Like, for example, they are calling like the juice, for example, over here, like, for example, by the way, my tea has no sugar, so don't worry about it. So basically, for example, if this is like a juice, mango juice, for example, and the mango juice over here is called on the label mango juice. But if you go back to the ingredient, it says mango concentrate, grape concentrate, pineapple concentrate, which is basically they are using the pineapple and grape for sweetening the juice. So in this case, we consider it as added sugar, and the taxation will be implemented on it. You got my point? So basically over here in Saudi, I know it's a harsh system for taxation somehow, but it's basically for the protection of human health that we are working on. So basically all fruit and veggie or whatever, all drinks that it's being sweetened with any amount of sugar, the taxation will be implemented. And of course, there is some sort of exclusions, for example, milk, some sort of what is called special dietary uses drinks. In this case, will be excluded from the taxation. Thank you so much.
Thank you, Dr. Faisal. That's really fascinating, the experience you just highlighted around the use of concentrates. And, I know juice is a controversial subject, but I do believe that taxing 100% juices is in our future, because from a metabolic point of view, our bodies really don't know the difference between, is this sugar coming from a Coca-Cola, or is this sugar coming from 100% fruit juice? They're metabolized very similarly and probably have similar health harms. And it's a complex and nuanced topic, and there would need to be a lot of education of public on, why is your morning orange juice harmful? But I do believe we will slowly inch that way. Dr. Nawal, would you like to add anything from Kuwait's experience?
well, I mean, it has been mentioned because it's a huge scope of drinks and that have been sugar added to them, whether it's a gel or a concentrate or an added sugar. So it's already been mentioned, yes, even dairy and its different flavors that have added sugar to them, they all will be having tax imposed on them. So, yeah.
Mm-hmm. Great. I would like to move on to a next question from our audience. This is a very interesting question. Are health arguments the only arguments we can use, or is revenue raising a good approach to use? Would anyone like to comment on that?
Please, can you repeat the question again? I don't understand.
The question is basically, in advocating for a sugary drink tax or a junk food tax, are health arguments the only arguments we can use, or is revenue raising a good approach to use? And Po, I saw you unmuted yourselves.
Yeah, I think for the sugary beverages, it's the health argument is an important argument to make, because I think from a treasury point of view, I mean, if we wanted to raise money because we want to fund government deficit and all of that, the issue will be that there are better instruments to use to raise revenue. So, because again, you know, the sugary beverage will be quite a small amount of revenue to raise if we really needed money. So I think the health argument here makes sense in a way. And then again, it will talk to the way the text is designed. As Dr. Franco was saying, you know, the way the text is designed can also communicate sort of like the motives around implementing a tax. So that's why then in our case, we targeted we designed the text in such a way that we targeted the sugar content to also communicate that message that the tax is implemented because we are concerned about the overconsumption of sugar from sugary beverages. And because again, from a nutrition point of view, like we have said, Nima, that these products from a nutrition point of view, they are not good for one's health. So we needed them to communicate around the health importance of implementing the text and in the way that we design the text. Thank you.
Thank you, Mpo. Arancha, would you like to comment?
Yeah, I think health is crucial, as you mentioned, but I also think that if your country is able to earmark, I think it is very important to say that you can raise a good amount of revenues, and that these revenues can be used to at least return to the population what they need to invest in health or another, or maybe in our case, because we don't have potable water, to invest in potable water fountains in schools. I think revenues, if they can be used, they're very useful, and you get support from the public if you can use them.
Mm-hmm. Dr. Faisal, please come in.
Yeah, thank you so much. I guess health is the most important thing. And in addition, the revenue, if we can actually take the advantage of the revenue that we are collecting from the taxation in order to, for example, fix our health system, that will be better as well. And in addition, in order to actually make it as a way, as Dr. Arancha said from the beginning, to help or subsidize the food industry or to reformulate their food products, that will be amazing. But of course, health is a top priority, and revenue, of course, for the other government is one of the priorities as well. Yeah, thank you so much.
And Po, I saw your hand up. Did you want to come in one more time? Yeah.
Yes, and I mean, I wanted to come to the issue about earmarking. I mean, our experience has been that when we started implementing the tax, I mean, there were calls for earmarking. But from a treasury point of view, then we made a commitment that we will make money available to the Department of Health to be able to do health promotion and other programs that they want to do, but without necessarily earmarking the revenue. Because, I mean, since implementation, money has been allocated to the Department of Health, about like 50 million rands every year, but the experience in terms of the expenditure to date has not been that good. So now, you know, it kind of like raises the issue to say that if then you had earmarked the revenue, basically then they will be sitting with over 7.8 billion that has been collected over the past 3 years, and without spending even the 50 million that has been allocated on a yearly basis. So then there'll be just a pot of money sitting there and no capacity to spend. So those are kind of like the issues that sort of like come into play when you deal with the issue of ring fencing. And then again, the other important issue is that depending on how you have designed your tax, if then say, for example, and I think that was the experience in the UK, where basically then you have this thresholds and all of that, and the industry start reformulating, and basically you have earmarked revenue, you have made this estimation about what you're going to collect and promise these programs that you are going to implement from that revenue, and you are sitting with a shortfall in terms of meeting your obligations. It becomes a problem. So that's why maybe from a treasury point of view, we sort of like stay away from sort of like committing legally money that is raised from any particular tax instruments. And I think in this case, if the tax is designed to reduce sugar content, you can imagine if all the products become zero sugar. So basically it means then your programs will have to find money somewhere, especially when you have started those programs when the tax was initially introduced, that it means to sustain them, you must get money elsewhere from the fiscals, which then again, you know, creates those problems. Thank you.
Really interesting points, Mpho. Thank you for that. There's so many great questions that have come in, and I wish we had more time to keep talking. It feels like we've just barely scratched the surface here. There is such a wealth of information from your experiences, and I'm really thankful to our panel for spending some time with us and sharing. Before I hand it over to Katrine to give us closing marks, I just really want to emphasize that we have lots of evidence. Evidence is emerging. In the short run, it looks really positive. You know, consumption of harmful beverages is coming down. People appear to be substituting to better options. There does not appear to be any job loss. So it's a positive picture overall. And I hope, you know, our audience leaves feeling like this is something their governments should seriously be looking at. And you know, the other thing I would say is in our toolbox of demand reduction policies, taxes are the one for which there is probably the most evidence at this moment. So in some ways, I would even go so far as to say, as all countries grapple with obesity and diet-related diseases, implementing fiscal measures is a no-brainer. So I'm going to hand it over to Katrine, and thank you all again to our panelists for being with us today and for this excellent conversation.
Thank you very much. Thank you, Nina, for the wonderful moderation, and also thank you to the interpreters, and a special thanks to Franco for the informative and scene-setting presentation at the beginning. We heard from Franco that taxes, especially SSB taxes, have been adopted widely by a large number of countries, including those that were present today. So a huge thank you for all the panelists from Kuwait, Mexico, Portugal, Saudi Arabia, and South Africa who took time off their very busy schedules to share valuable insights from their country experiences in developing, implementing, and also evaluating fiscal policies to promote healthy diet. You've reinforced that implementing fiscal policies is indeed a viable policy option to promote healthy diets, and it's acceptable to most actors. I liked the note that, as Portugal mentioned, 85% of the public is behind the tax. That's an excellent number. It's also become very clear that our government counterparts must be vigilant and very well prepared to counter opposition and interference in the policymaking process, as we've heard from Mexico and Portugal. So we do need to stand strong in the interest of public health. And the country experiences as shared today reinforce that health can be a driver for fiscal measures. And high levels of overweight and obesity, especially also of children, are calling for an urgent need for action. And we've heard about the impact, so I won't go into that in view of the time. And I would just like to really mention once again that we need to ensure collaboration between ministries of health and finance, and we need to push action even further, as we've heard from South Africa, in the interest of public health. So also stay tuned for the forthcoming WHO guidelines on fiscal policies, which Franco mentioned at the beginning. And just to remind everyone on the call that this was the 6th in a series of webinars. There's one more remaining on marketing and labeling tomorrow at 1 p.m. So on behalf of my colleagues, Joe from UNICEF, Fabio from WHO PAHO, Polly from WHO Euro, who helped organize the session, I just want to wish you all a wonderful morning, rest of the day and evening. And I'd like to close the session with one reminder. As Franco said, health can be the driver in the design of fiscal policies. So thank you very much and goodbye to everyone.
Thank you so much.
Thank you.
Thank you. Have a great day ahead. Thank you so much. Thank you.
Bye-bye, everyone.
Bye-bye.
Thank you.
Thank you.
Thank you so much, everyone. Really appreciate it.
Thank you.
Thanks.
Yeah.